Today's world has considered the COVID-19 as a deadly virus. The pandemic has marked the borders in the 21st century, when it's considered that the world's governments and the health systems are more equipped. But history registered more devastating pests that in a short time were more lethal for humanity. In the midst of the 14th century, between 1346 and 1347, the mouse fever epidemic in Europe exploited. The Black Plague, an evil and lethal host from which no treatment was known. This plague swept with their lives of poor and rich people, with no distinction. The deadly pandemic took the lives of more than 50 million people across Europe. We moved 102 years in the past. In March 1918, a microscopic killer just as dangerous and considered the most deadly in history emerged in a United States military base: the Spanish flu. In April of the same year, already wreaking havoc in the trenches of Western Europe, from France to Great Britain, as well as Italy and Spain. It is estimated that the death rate from this pandemic was concentrated between 10 and 20% and killed between 50 and 100 million people worldwide. In Spain, the number of deceased is estimated at 300,000.
But I want you to imagine that the death toll was so severe that in some countries they actually ran out of coffins.
In the third and last wave, the Spanish flu was more controlled. By the spring of 1919, the population was already immunized. And in the summer of 1920, before a cure was found, the pandemic disappeared on its own.
The population continues to grow. We continue to live and encroach upon spaces that we were never there. We were never there before. So all of a sudden we're exposing ourselves to new viruses from animals that our immune system has never seen and we're not protected against.
Now, history seems to repeat itself with the appearance of COVID-19, but in a more civilized world with more scientific advances. The number of deaths and the number of infections by COVID-19 since the first case was detected in Wuhan, China, show us that the pandemic has not been as overwhelming as the microscopic threats recorded in the history of humanity. Although the numbers continue to grow, the humanity of the 21st century, amid uncertainty, awaits the end of COVID-19 or the resignation of living with the virus.